Hi, this is Robin Riddle with Brain Support Network. I'm so glad to be able to talk to you today about MSA brain donation. How can it help MSA families? How does it help researchers? And how is brain donation arranged? Brain Support Network has actually arranged over 800 brain donations to date. We'd be honored to help your family with this as well. First, a little bit about terminology. We are sometimes asked what's the difference between a brain autopsy and a brain donation. A brain donation actually includes some aspects of a brain autopsy. A brain is analyzed post-mortem in both cases. For a brain autopsy, reports that are given to families are very rarely prepared by a neuropathologist. There are not very many neuropathologists in the United States. They're kind of a precious commodity. And if the brain is autopsied only, the brain is destroyed after analysis, which we would consider to be a pity. In the case of a brain donation, reports are always prepared for families by a neuropathologist, and the brain is saved in perpetuity for research, which is a wonderful thing because that helps us all. Sometimes families contact us and also ask about body donation. We've probably done, in the last year, we've probably done 10 joint brain body donations. And this is only possible in the case where a medical school or a company will allow a body to be donated if the brain has been removed. This doesn't always happen, but sometimes researchers, medical schools, and organizations will allow this. In the case of body donation, there's no report given to the family, and sometimes cremains are returned to the family. In the case of body autopsy, the family may receive a report from a pathologist, and the body is always returned for cremation or burial. Um, we don't get very many requests for body autopsy, but as I said, we have on quite a few occasions done joint brain body donation arrangements. One last bit of terminology is about organ donation. A lot of people are familiar with this because they might have driver's licenses with a little pink dot on it. That's what we have in California, which indicates you want to be an organ donor. What this is referring to is in the case of organ donation for a transplant, if you're in a car accident and you're pronounced brain dead, but your heart can be kept pumping, then the heart, lung, kidney, for example, could be used for a transplant to save someone's life. Other things like bone, skin, and eye can be retrieved at a funeral home if the funeral home is cooperative within a few hours of death. And other organ donation is possible for research. And for that, you would need to contact your local organ donation organization. It is quite complicated to coordinate a joint organ donation for research and brain donation, but it is possible. We've done that a handful of times as well. There are two key reasons for brain donation. The first is the confirmation of a diagnosis. This is in fact only possible through a post-mortem examination of the brain tissue. Unfortunately, as you know, with MSA, there are no biomarkers, no imaging study, no blood test, no way to determine if somebody in fact has MSA. The only way to know for sure is to examine the brain after death. Brain donation in this way is a wonderful thing because it gives closure and peace of mind to the family. It allows the family to know exactly what neurodegenerative disorder caused these symptoms. This might be very helpful to children and other family members. And in fact, there's an incorrect diagnosis in 40% of all MSA cases. It's quite astonishing that you could, in fact, flip a coin and have a very similar outcome to a diagnosis. The second reason for brain donation is that it enables research into the causes, treatments, and cure for MSA. diagnostic criteria are based on confirmed cases of MSA. That's how we know what the diagnostic criteria are, because we can rely on those cases of people who died and who actually had MSA. And so the criteria are only as good as the support in the community for brain donation. And brain tissue is required for all kinds of research, as you can see on the slide. There's a wonderful example of a brain bank study that Brain Support Network provided about 25 of the brains used in this study. It was published about 5 years ago by the Mayo Clinic, and it was called When Dementia with Lewy Bodies, Parkinson's Disease, and PSP Masquerade as Multiple System Atrophy. And this is where we get the statistic that the diagnosis of MSA while someone is alive is wrong 40% of the time. And as you can see from the title of the article, the most common misdiagnoses are dementia with Lewy bodies and Parkinson's disease. A lot of MSA research is made possible only through brain donation. One question that many of us have is cognitive impairment part of multiple system atrophy? Is dementia part of MSA? Are hallucinations and delusions part of MSA? At what stage of MSA could they be part? We know about the expected disease course and prognosis only through brain donation. And if we are ever going to enroll the right people in research studies, meaning if we want to be sure that people have MSA and we're enrolling them in MSA research, how do we know that in fact they really do have MSA if the diagnosis is wrong 40% of the time? Brain Support Network recommends the Mayo Clinic Brain Bank. They're one of the top brain banks in the United States, in fact, in the world. They actively publish on MSA using donated brain tissue. I talked about that article that was published 5 years ago. There have been many others since then, but that was one of the most important ones that's been published. And they provide reports to families in about 100 days. They're actually a little bit faster than that now. They're getting reports to families in about 50 days because with the pandemic, the neuropathologist and other staff members have been stuck at the Mayo Clinic and can't travel to conferences at all. And so they've been available to do neuropathology reports to families. It is very important that families order neurological records and provide a written timeline of symptoms to the Mayo Clinic. That's a very important part of the neuropathology report and a very important aspect of conducting research in the future. There are some challenges with brain donation. One key challenge is a time factor. The brain must be recovered within 24 hours of a loved one's passing. And families generally bear the cost of this brain recovery, typically costs $600 to $1,000 in most parts of the United States. And I do want to note that the organization Cure PSP offers grants to MSA families up to $750. So it is very possible that this grant from Cure PSP will cover all of the cost or most of the cost for brain donation for MSA. Advanced arrangements have to be made with a lot of organizations involved. That's where Brain Support Network comes in. We coordinate all the arrangements with the funeral home, body donation program if there is one, with the pathology service, hospice, care facility, and anyone else involved in the brain donation. Donating a brain requires the consent of the healthcare power of attorney or the legal next of kin. This varies, the definition of this varies by state. In California, for example, it's the healthcare agent who's the person in charge. In other states, it's the legal next of kin, the spouse, oldest adult child, and so on. As I mentioned before, the family must order all the neurological records, and that can be quite time consuming depending on how many physicians you've seen. The pathology service must be available daily. We oftentimes will have families contact us that will indicate that they found a pathology service, but that service is only available Monday through Friday. Well, that's not going to work out if the brain has to be recovered within 24 hours of death. And finally, knowing who's doing what, when, for how much money, and why they're doing it is a very important aspect of donating a brain. Many parties have to cooperate, as I mentioned before: funeral home, hospice agency, care facility, if there is one. And Brain Support Network coordinates all of the participants and prepares very comprehensive instructions for each party involved. We, as a nonprofit organization, request a pay it forward charitable contribution from every family we help. For $500 donated, that is, for every $500 donated, we can help another family with brain donation arrangements. We certainly welcome memorial contributions in lieu of flowers. So we encourage you to start making brain donation arrangements when the intended donor is receiving hospice care or palliative care. That would be a terrific time to start making plans for this. And then once you've made the plans, you can put them aside and focus on other more fun topics of life. It's also would be a good red flag if if the intended donor has been hospitalized, and certainly when the intended donor is actively dying. Making arrangements at this very stressful time can be hard for all of us, including the family and Brain Support Network staff. So it's important to make arrangements as soon as possible. As you probably know, with MSA, many diagnosed people pass away before even entering hospice. They often pass away in their sleep. And so it's really important in MSA to make arrangements even before somebody is on hospice. We welcome any kind of advance arrangements. We encourage you to check out the Brain Support Network website. I've listed the web address on our slide. And we also have there on our website several case studies for people who were diagnosed accurately during life with MSA. And it turned out when we made arrangements for their brain donation, they did indeed have MSA upon brain autopsy. And then there's an example of one person who was diagnosed during life with MSA, but in fact had Parkinson's disease. And we've seen many examples, but we have one case study here of people diagnosed with MSA during life who have Lewy body dementia upon brain donation. We have an extensive list of frequently asked questions and a process document on our website. The process document, as you can see generally on the slide, talks about things that the family needs to do and the things that Brain Support Network will be doing. And our detailed instructions go line by line through each of these tasks on both sides of the slide here, both the donor's family's task and BSN's task. And we identify in quite comprehensive detail what needs to be done before a loved one's passing and at the time of passing. We encourage you to come to our website, brainsupportnetwork.org, and fill out a soon or immediate need form, depending on the circumstance. Brain Support Network was a nonprofit. We were founded in 2004, and we became a nonprofit in 2012. We have 5 employees, all working from home. We were working from home before the pandemic, so it's not a big transition to us to be working from home during the pandemic. We have dozens of volunteers. We're based in Menlo Park, which is south of San Francisco. And as I mentioned, we've organized over 800 brain donations. Most of these people have had neurological diagnoses, but a few very generous people have been normal, healthy controls, and they've donated their brains as well. So we've helped over 100 families donate a loved one's brain. We'd be very honored to help your family as well. And at this point, I invite any questions that you might have about brain donation specifically for MSA or any other neurological disorder, or perhaps even the healthy controls among you will be interested in that as well. Thank you so much.